Welcome back to In the Loop. 1 out of 3 Americans are currently obese, and the problem is expected to get worse. Some analysts, in fact, say it could cost the U.S. billions in health-related costs. Bloomberg's Shannon Pettypiece right beside me here in the newsroom. Shannon, you've been digging through the numbers. Just how bad can it get, and by when?
Well, there's a new study out, a projection that looking out to 2013, if we stay on the current path that we're at, by 2030, so 20 years from now, half of Americans could be obese, 165 million Americans. And I know that sort of sounds far off, but it really isn't if we think about...
No, it's one generation.
Right, when some of us are retiring, when our kids are going out into the workforce. 1 in 2 Americans, half of all Americans are obese. That will be an extra 8 million cases of diabetes, 7 million cases of heart disease, and it poses a threat, epidemiologists and health experts say, of really crushing our healthcare system. We don't have the infrastructure to be able to handle all the diseases that will come along with that big of a population being obese.
So as far as the estimates that are out there, I mean, how much could this cost?
Well, looking out through 2030, if this goes as it's projected, an extra $66 billion a year in costs each year, starting in 2030, $66 billion. Now, that's already on top of enormous costs that we're paying already. Mike Milken and the Milken Institute, they've done a lot of research on this because he's very concerned about the economic repercussions of this. He estimates that as of now, if we went back to the weight we were in 1991, it would save us $1 trillion. So when we're talking about economic stimulus...
And that's not even that far back.
That's not even that far back. That's in most of our lifetime. So, a lot of folks are saying that this is not just a public health issue. This is becoming an economic issue. And as we're trying to pay down the deficit and we're trying to stimulate the economy, this is something that we need to consider. This is a real business economic problem we have here.
What are experts proposing as far as solutions?
Well, the troubling thing is, too, that we don't really have anything that works. There doesn't really appear to be anything that works. Restaurants are trying to do healthier things. Burger King is, but,
and list,
so far.
Of course, list the caloric content, list the fat content. I mean, and I know, at least in movie theaters, that was something of a controversy, right, with the popcorn,
right.
But it finally got passed through.
And but there's still no model that shows, we're seeing a reduction here. There's still nothing that's proven to work. So that's also troubling as well.
All right. Shannon, thanks so much. Shannon Pettypiece joining us there on future additional costs to the nation's healthcare system.